Good morning, welcome. This is the second session of the Select Committee on the Armed Forces Bill. We have two panels of witnesses this morning. This is our first panel. You're very welcome. So can I start by asking you to introduce yourselves? I'll start with Caroline in the room. So Caroline, would you introduce yourself, and then I will call on the people who are coming in virtually one by one after that.
Thank you. My name is Caroline Bell, knee hopper. I was married last week. You can call me either and I'll answer to it. So,
congratulations.
Thank you. So I'm the lead officer for the Armed Forces Covenant at Portsmouth. I'm also the lead for the Solent Armed Forces Covenant Partnership Board. I also have interest as the strategic lead for violence against women and girls, serious violence and community safety that's relevant to the bill, but perhaps not today's session, but just to let you know that. I co-chair the local government Covenant Officers Group alongside Canon Peter Bruinvels there, and I'm also the public sector rep on the South East Reserve Force and Cadet Associations Board.
I should have checked, of course, that everyone was okay with first names. We're
very happy.
Everyone's okay. Excellent. So can I come to you, Peter?
Yes, good morning, Chairman. Thank you very much for inviting me. I'm Canon Peter Bruinvels. I'm the Armed Forces Covenant lead for both Surrey County Council and Kent County Council. I chair the Gold Awards Association for the South East. Like Caroline Bell, we're both co-chairs of the Armed Forces Covenant Lead Officers Group for the LGA. And I'm a ministerial advisor and a former Army civil servant specialising in the Armed Forces Covenant since 2012.
Excellent. Mike.
Hi there, good morning, Chairman, and everyone in the room there. Mike Callaghan, representing the Convention of Scottish Local Authorities, otherwise known as COSLA. I take a lead for COSLA on the Armed Forces Covenant as part of my broader remit on housing and homelessness. And other areas I cover COSLA. We work for the COSLA report to the COSLA Community Wellbeing Board, which is chaired by our spokesperson, Councillor Maureen Chalmers. Thank you.
Thank you. Kate.
Good morning, everyone, and massive apologies. I'm not there in person today. I'm suffering from a bit of a cold. I'm sure you don't want my germs, so I apologise for that. So Kate Davies, I'm the National Director in currently NHS England for the Armed Forces commissioning across the NHS. I'm also the National Director for Commissioning Health and Justice and Sexual Assault Services that do have an integration with both the bill, but also the work that we do with our armed forces community and families. I've been in the national role as the director since 2012 and have a national armed forces team within the NHS currently. So thank you very much for inviting me.
Thank you. So we'll go straight to questions there. So Ian.
Yep. Good morning. Firstly, thank you for the work that you do with the armed forces community and obviously the greater public at large within your role. So thank you very much on behalf of the committee. The bill would extend the scope of the Armed Forces Covenant to cover a number of new policy areas. What will the practical impact of this be on local authorities and in particular on the NHS? So I'm sure Kate will be the one that answers that one. But I don't know, Caroline, do you want to start?
Yeah, I mean, I'm aware that we don't have much time this morning, so I'll be brief and I'm sure other colleagues will pick it up. But I mean, across local government, we really do welcome the expansion of the Armed Forces Covenant. And I want that to be the point that sticks in our mind. However, I think a practical implication point of view, we are a bit worried about how we're going to deliver this at a time of great change in local government. So we're obviously going through devolution and local government reorganisation, and we're going to need some really clear steers on how we make the covenant stick and ensure that organisational memory through this process, and I think that is a key risk for us. We are constrained in terms of funding, and I think you're aware of that across local government, and there hasn't been any burden put on the delivery of the Armed Forces Covenant. So it really has delivered by enthusiasm to date. And again, combined with that systemic change that's coming up, I think there's some real risk there that we're going to lose really good people who know what they're doing in that process of change and perhaps not have the capacity to deliver the ambition set out in this broadening of the areas. So I think there is a real need for us to understand the resourcing that sits behind this in order to be able to systemically embed this, because I think there is absolutely stuff about that surface work around raising awareness and training and practical guidance, which absolutely I think we can nail quite quickly. I think that systemic work around how do you get your systems working, how do we work smarter, not harder? So how are we making sure that our veterans are noted in the homeless count that comes into central government so that you have a good eye on that, for example, so that you're really maximising this opportunity? That is a practical concern for us because that kind of change will require resources. I'll let others chip in.
Thank you. Peter, do you want to go next?
Thank you very much. I, like Caroline, certainly welcome the expansion of it, but the problem is with local government and devolution, we're going to lose quite a lot of our trained armed forces councillor champions and indeed also our covenant lead officers, and that is a major issue. Colonel Carnes, who's obviously the Veterans Minister, and we know each other well, welcome to you, was very keen that covenant officers should be centrally funded. That's going to be the big issue. And of course, in Wales, the Welsh Government directly fund all their armed forces liaison officers. And I think that needs to be looked at. We're also, because of local government reorganisation, going to lose quite a lot of our trained covenant lead officers. The other thing is I would phase in the expansion. I think it's very important employment is added, spousal employment. I'm also keen on social care, particularly for the SEND and the EHCP plans, because, as you know, the armed forces move every 2 years and they could lose out on this because there may be changes. Immigration is important and school transport. So we welcome it, but there are major financial implications. And the only other thing quickly is, I don't think there's been a full impact assessment on each of these new departments. And obviously, if we're going to have all these new departments, I would be recommending that there's a covenant lead minister in every department, including obviously the devolved assemblies.
Okay, Kate?
Yeah, I mean, we've been campaigning for some time to get sort of more input through a bill and an act, and I think this is greatly welcome, as my colleagues have already said. For the NHS, I hope that people would recognise that we're starting kind of running, really, because for the last 10 years, and certainly for the last 7 or 8 years, we've been really focusing on how we embed the understanding of the armed forces community, so as well as veterans, what that means for serving reservists and their families and carers. And I think that is really ultimately what we should be doing going the way forward. We have to make quite sure in the NHS that we don't rely on, and in local authorities, as part of the growth on adult social care, that we don't rely on people that have been in the armed forces or are the champions. I think that's an excellent model. However, in order to make this work, we have to get all of our staff in the NHS and all of our patients and families to understand, one, what does that mean when there is certain language that may be complicated or confusing, and also the understanding of what that is in legislation like any other kind of legislation, i.e. Safeguarding Equality Act, so on and so forth. And I think that's really important as we go forward. I mean, I think also let's not make this too complicated. Within the NHS, on a local basis, as a patient, whether you're coming from a GP's practice, a hospital, or very specialist care because of your needs as an armed forces past or present member, including physical healthcare, mental health care, family healthcare, dentistry, then I think simple elements of have you ever served? Are you a family member? At the point of access and also the point of check and review is absolutely essential. And I think what we're trying to do in summary is make quite sure that, and I'll go through this with other questions, I'm sure, with services that we commission across the NHS, bespoke services for the armed forces community, and our partnership services, that we're trying to ensure that both our staff across all elements understands what that means. And we also get specialist elements that have served, our lived experience, have clinical expertise, and I think that's the way forward for the bill. Look, the bit that's really important, I think, is about adult social care, as my colleagues have said, how that will work with integrated care boards, with the neighbourhood teams, and also with police and crime commissioners and local authorities, particularly around violence against women and girls, and some of the issues around access points through homelessness, the criminal justice system, or other self-referral routes. So, it all is positive, build on those positives, promote the good practice, but also make quite sure it's everybody's responsibility. Thank you.
Ian.
Could I just check one thing, Kate? At the moment, as part of being a patient at the NHS presenting to the GP or to ED, do you get asked whether you are a veteran or you have ever served, or is that something that you would be looking to implement as part of the bill?
That is something that we've already implemented. Part of that is 3 approaches over the last few years that have been commissioned, because I think the other element of this is it does, and I know that's a challenge for all of us, but it does require funding and systems. So we have 2 major accreditation programs across the NHS, one for GP accreditation, Royal College of General Practitioners help lead that across all primary care networks. We have the Veterans Covenant Health Alliance across all acute trusts, also across ambulance services, and also the rollout also within social care and older care facilities. And we have just recently commissioned a £1.8 million training programme called the National Education and Training Programme for Armed Forces, which only went live in November 2025. And since that has gone live, we have 149 trusts that have signed up to it. So I can certainly build on that as we go forward. But I think you're absolutely right in the question. The ultimate element is getting that skill base, that training, those silly questions, those daft questions that staff need to ask maybe in a training session or something more private, and as part of the refreshment of accreditation schemes across the NHS with ICBs.
Okay. Paul, you wanted to come in?
Yeah, thanks, Chair. Yeah, just on that last point you raised there, I can confirm, actually, first time ever I changed doctors recently, and for the first time ever I was specifically asked if I was a veteran.
Thank you.
So it is, and it's now, and I'm now tagged as a veteran through the NHS system, just as a side, so it is working and coming through. As a former council leader, district council leader up in Lancashire, I'm interested to explore slightly more these concerns that you have about local government reform, because I don't necessarily share those concerns. Because if you're, for example, up where we are in Lancashire, South Ribble and Chorley and West Lancs and Lancashire County Council, all have covenant officers that work closely together already, have armed forces champions who all work closely together already, but there's also a lot of replication then as well through the 2-tier system. And so clearly, as we're changing from 2-tier to unitary in Lancashire, there's still a statutory obligation for that new unitary authority to have, you know, its lead covenant officer and armed forces champion. So I actually feel it's a massive opportunity here, not necessarily a concern. So could I just explore that with the panel, please, Chair?
Could I respond?
Peter, you put your hand up to respond, so I'll take you first. Go on.
Thank you very much. I train armed forces awareness all over the country, and at 10 o'clock this morning I've got over 50 councillors and others coming to a major training session. And I do a lot of work in Lancashire out of interest, and I'm very impressed with the way that the Lancashire county councillors and councillors attend the meetings. However, under the unitary, there's going to be far less of them, and there's going to be far less armed forces champions, and there's going to be far less covenant lead officers. And I'm actually nervous about it, and I'm quite sorry that everything to do with the Armed Forces Bill wasn't linked to the local government reform. I put a submission in last year where I thought, for instance, the mayor should have responsibility already they have for the police and the fire, but I thought they should have the armed forces as well, and they would be effectively a blue light mayor. Now, I sounded a lot of people out on that, and that's received a lot of support. The important thing is I want consistency of delivery, and we want to be reassured, you know, you're asking the question, did you serve? Everyone is asking that question, and that the councils can be equipped for that. And my fear is, and I'm not against unitaries, indeed, my local county council is separating into East and West Surrey next year. It begins with shadow elections this year. But at the moment, we have a central board that delivers, and I model it very much on the Manchester Authority Board, Chris Thomas, who runs that, with the mayor. And they do deliver a consistency across the whole of the area. I'm just nervous that our service personnel may lose out. And then the other side, a quick caveat, as we expand the covenant, I just want to give the warning. We've got to manage the expectations of the armed forces, because they might think they can get everything out of it. It might be a golden ticket. And remember, they're not used to asking for help in the first place. So I'm very grateful to the councillors for what they do, but they themselves say they need to be refreshed. I'm doing Armed Forces Bill training today because they've asked for it.
Okay, Mike, I'm conscious I haven't brought you in yet, but I've got another person who wants to come in on this section of the questions. I'm going to take Jane, and then I'll ask, because otherwise I'll go round and round and round. So, and we'll run out of time. So, Jane, if you ask your question, then Mike, if you could just cover everything, I'll come to you next, and then come to you, Caroline. Yeah.
Thank you very much, Chair. It was just really to ask. Obviously, people have issues when they go and speak to people in health, be it primary or secondary, or social care, about having to retell their story a number of times. And I'm wondering how you can make it so that when people have said once, then it is, I know that new digital records are coming up in the NHS, and I'm hoping that provision's been made there, but also with social care as well, because it is hard for people to know that once they've told their story once, particularly for the families as well as the veterans or serving personnel, that it will remain on their records.
Okay, Mike, and then I'll come to Caroline. Thank
you, Chair. I agree with concur with a lot of good points made by Caroline and Peter from a local government perspective. From a Scottish local government perspective, we had a meeting just towards the end of December with our elected members, veterans champions, as well as other representatives who lead on the Armed Forces Covenant, and the expansion of the range of policy areas services was broadly welcomed. I think what it represents is obviously a major shift for the Armed Forces Covenant in respect of moving from a localised set of obligations within the local government, which we're fairly used to in Scotland. We will obviously implement the Armed Forces Covenant on a voluntary basis for almost a decade before we had a duty to have regard. But it's going to have a major change of a whole government multi-sector framework with obviously in Scotland the devolved Scottish Government having a responsibility for it. So just like what Caroline and Peter have reflected, greater expectations in Scotland with the devolved level duties, broader policy areas, increased need for coordination, monitoring, staff training, and of course the need for more resources, really, if we're going to take this seriously for this implementation. What we have at the moment is local authorities in Scotland, just like other parts of the UK, are really stretched and very much committed and politically have unwavering support for the Armed Forces Covenant, but it's about the need to implement at a local level, and certainly if you're going to broaden these other service areas for local government, we really will need more resources to meet the expectations that will obviously occur with this legislation. But generally, though, we're positive and supportive of the bill.
Caroline. Thank you, Mike.
Just to be very brief, so in terms of the local government reorganisation devolution, the reality of that systemic change at the moment is it is sucking up a huge amount of capacity in those local authority areas that are going through it. So that is one area of risk for the Covenant, is that because it's not a defined item of that structural change, it sits to one side and waits to be picked up. I agree with you that over time there's real opportunities, but there's opportunities to level up in areas like the southeast where we're looking at our surrounding authorities that we may join with, because Portsmouth is part of that priority programme, and I think we'll end up with a very strong unitary because we are in a partnership already, we have strong foundations, and we will level up. But I think there are other areas where they may have races to the bottom because they will be struggling with the different priorities of becoming a unitary at the same time as trying to deliver this duty. So I think what we really need is that clear guidance coming down to not forget about the Covenant within all of this. I think that would be really useful. In terms of what you said around the holistic assessment, that is something that we struggle with and we would want. Absolutely, would really appreciate that kind of national steer on. There is work going on, for example, through Northumbria University with the Marines charity to develop what they've called the hard facts common assessment model. And anyone who has a knowledge of children's services will know that the common assessment framework was implemented in 2008. And it takes time to embed, but it has been a complete game changer in terms of early help and how we work around children and their families. And we don't end up with multiple professionals, or ideally not multiple professionals, telling stories several times, fragmented pathways and gaps. I appreciate the ideal world. But that is an opportunity with this cohort that could be gripped, particularly through the delivery of this bill and other programmes such as Valor coming through.
Okay, Kate, did you have anything to respond to those additional questions?
Yeah, I think that the question about non-repeating and stories is one that comes up very regularly. And to be honest, it's been our lived experience governance that's really helped us shape and model that alongside our partners in particularly Defence Medical Services and the OVA, because of the pathways coming in and out of serving, or even, I think as we probably heard from the sessions on the panels yesterday, families particularly are moving more regularly than most families in the community for civilians. So it is about setting up particular models that will help that. So yes, we have had digital adaptation to NHS systems and the recodes that will mean that GPs and hospital trusts and the whole patient record will then identify that somebody has served, and also what that means as part of a family member. But ultimately, we've also set up single point of contact service, particularly for families and more complex cases, because I think it's the more complex cases when somebody maybe has mental health, prosthetics, other elements within that, children particularly who are poorly from the serving community. So I think it is important to also wrap around some of those at scale national and local elements, because it's very difficult to have that on a local level everywhere to do with cost, funding, and also necessarily quality. But I think it's a mixture of those two. Look, we have a number of bespoke services that we've now commissioned over the last 7 or 8 years around mental health and physical health and criminal justice system. And they've been a game changer, quite frankly, for not retelling your story, but also having something that links you into your own specialist, in inverted commas. And I think that's important going forward. But it's a challenge. And I think it's one of those challenges because of also the NHS and or local authorities in social care understanding the transient route and the movement, and also how difficult sometimes it is just to say what your problem is in a family when you're part of a serving community. There are certain elements that become quite tricky, and people need to know that people understand their situations.
Thank you very much. We're going to move on now. Luke?
Yeah, this was touched on a little bit in the previous round of answers, but what are the resource implications of the expanded duty for service providers? And related to that, were local government and NHS representatives involved in designing the expanded duty?
Who'd like to go first? Caroline.
Quite happy to, seeing there's no sign. So there was 2 parts of that question. I clocked the last part, but the first part...
So the first part was about the resource implications, and the second part was, were you involved in designing the expanded duty?
So I think in terms of the resource implications, I'd lean back into what Peter has already said, that we do feel that there needs to be a full integrated impact assessment that we can contribute to, so that you can fully understand those resource implications, and also maybe think about that phasing so that we can get this right, because I think there is something about those system changes that really fundamentally need to take place. We're living more and more in a digital age, and the reality of some of that stuff is we're not working on spreadsheets. We need to work with providers who can help us to put those centralised fields into those systems so that we can have coherent data pool. Otherwise, we're not going to have good intelligence to work on, and actually those fundamentally having those needs assessments is a starting point. And at the moment our data is fragmented. I think the The census data was fantastic, and I'd like to take this opportunity to say I really do hope the question continues, because I think there was that we've heard a sense that it might not, and that I think would be a loss for this area. But it's not enough. We need to be able to pull together our local data, that health data, that housing data, education and so on. So I think we'd really value the opportunity to go through that process with you. We did do some work across local government in the tail end of 2024, reasonably good piece of work at pace to try and articulate some of the unseen costs, for example, those system changes, workforce development. We're talking about large cohorts of staff across children's, adult services here that will need to be changed. And I agree with Kate, this is about being systemic. This isn't about just having one person who holds it for the team and has a single point of failure. This is about making sure that everybody is thinking forces and that they're thinking forces in all the ways we need them to be. In terms of the consultation, I think we've appreciated the involvement that we have had, and we appreciate that sometimes it can be challenging to schedule that in, but I think we would want to have more involvement, always more, and particularly now in that development of the guidance and resources and how this is delivered, because ultimately it's about, you've set up some really good infrastructure in this bill, but what we need to do is work together to provide that clear framework that's consistent across bodies in range in order to deliver it.
Peter, you raised your hand.
Thank you very much. I think it's a brilliant question, I have to say. It's really important. I hinted earlier on that I would like to see fully funded Covenant lead officers, and I would like them to be funded centrally. Quoting Al Carnes before when he was at the Winchester at the Armed Forces Covenant Conference, but that was his early days, and I don't know if that's realistic now. What I want to see, and it is a recommendation in my submission, that those elected councillors and those Covenant lead officers are treated as public appointments, and the resource issue is that they are funded to do that. There's an allowance, and it is a public appointment for the Covenant lead, for the Armed Forces champion. The issue about consultation is a tricky one. Yes, Caroline is right. We were consulted to an extent, but when we had the last bill, I chaired for the South East of England focus groups on education and employment, and they worked really well because we brought all the practitioners together. There was a parallel one on health, and there was a parallel one on housing. So I would recommend that we get statutory guidelines issued, code of practices, and you involve the Covenant lead officers and the Armed Forces champions. I'm really grateful for that question.
Excellent. Mike, Kate, you're indicating.
Yeah, thank you very much. Look, design opportunity, yes, I sat in front of the committee this time last year. I think one of the things that is really important about design is actually to keep designing and to keep having those conversations. It is actually a really important time with the new legislation within the NHS coming in April 2027, as we'll go through the passage of that bill, to actually use this as an opportunity to continue to do that design opportunity in the way that we're looking at the ICBs, strategic ICBs and the local authorities, and do it right from the beginning, and so that it becomes a requirement and the norm as part of that legislation. We're working obviously as part of both the primary and the secondary legislation to ensure that that is strong as part of the Armed Forces Covenant, but also actually, to be honest, beyond the Armed Forces Covenant, it's about understanding what that means for the Armed Forces community, regardless of the Covenant, and understanding what disadvantage and advantage means, and clinical priority, and how we work with particularly serving personnel as well. So I think that's constant and needs to be constant. That's my message. I think there is an element around resource implication, which I agree with my colleagues on this call. There has to be finance. I have had great support from NHS England through Sir Simon Stevens and then Amanda Pritchard, who actually publicly signed the Armed Forces Covenant about this time a year and a half ago, and also with Jim Mackey, making quite sure that leadership resource is also absolutely key across ICBs, local authorities, social care, because it is about finance and funding for people, families, but it's also about making quite sure it's embedded all the way across as part of that resource as well. So thank you.
Mike.
Thank you. Thanks, Chair. Very good question, as was answered by my local government colleagues there. Yes, undoubtedly, with the expansion of the Covenant from 3 to almost around about 14 different areas, this is going to have significant implications. There will be obviously benefits from it as well, and having a more sort of holistic, integrated and policy approach from national to a local level, and much better working between the UK, different spheres of government, the UK government, Scottish devolved government, and Scottish local government in respect of its implementation opportunities. But it'll be a lot more complex for these cross-government processes, increased expectation, and undoubtedly from a staff resource will be the need for more training, enhanced data gathering and reporting, stronger engagement with armed forces communities, and better coordination with ourselves and the Scottish local government, the Scottish government and the UK government. So undoubtedly will require more resources for the implementation. In respect of us being involved in the design process, I'd say to an extent. Last year, we welcomed the opportunity to give some evidence to the Defence Committee inquiry almost about a year ago. But we've had some input, but we'd obviously welcome some more in terms of being more of a co-design process and have great input alongside our local government colleagues across the UK. Thank you.
Okay, the Minister's got a question, but I'm going to have to ask for very concise answers so that we can cover all the topics that we'd like to cover in this session. Minister.
First of all, I'd just like to thank you all for your continued efforts for the Covenant and the Armed Forces community. It's really an open-ended question, but how do you think the implementation of centrally funded Valour officers based into a data-led network may support our ability to implement the Covenant and provide an element of consistency over that implementation? And what balance do you think there should be between council-led initiatives and centrally funded ones? Probably to Peter more than anyone else.
Okay, Peter.
Thank you very much, Colonel. Well, I think it's, again, a good question. It all depends on the data. And we've got to be confident that the data is correct in the first place. And also, of course, the regional officers for Valour have yet to be appointed. They're slowly being appointed. I don't want a doubling up, but I also don't want people to fall between the crack when they think they're being looked after by the Covenant officers when, in fact, Valour's doing it. And there was a meeting recently of all the Covenant lead officers across the country, and Valour turned up and said, how many of you would like to be regional officers? And we don't want to lose these officers because they're expert. So the worry is that the data's accurate, that they trust Valour, and also that the Covenant officers and the service charities, of which, as you know, there's over 2,000, are being properly used. So not a brilliantly concise answer. A challenge. Let's see how it goes. But Manchester's one of the first, and I know we'll be working together on this. I have no doubt.
You set a high bar. Now, anybody else want to? Caroline?
Yeah, I think just to go back and reiterate again the importance of that systemic and mainstreaming approach. So whilst we welcome any intervention from central government and looking at that connection locally, we need this to be embedded in frontline services, because it cannot all fall to central government civil service officers to deliver for what is an incredibly large community. I see what you've done in the Armed Forces Bill as good infrastructure, and someone once told me, if the infrastructure is good, you do not feel it, you seamlessly move through it. So what we need to think about is how, when we're implementing this, do our communities seamlessly move through the system, not experiencing difference? And the only way they're going to be able to do that is if we have embedded it across all of those public bodies in range. And that is where having those lead points connected into Valour as a very specific programme will be important.
Okay. Mike, you have anything to add?
Just very briefly, I think the whole principle and rationale behind Valour is positive. I think from a Scottish perspective, though, it's just about implementation into Scotland's distinct public sector arrangements, and also how it's implemented in respect of the sheer geographical size of Scotland as an entity. I think that's some of the feedback we've been receiving so far. Thank you.
Thank you for that. Kate?
Look, I think it's Minister making quite sure. I welcome Valor, and I've been part of Valor and I was on Valor's board this week, so it was really, really great to be seeing it really moving forward. But I think it's about making quite sure that Valor understands what's already going on, and so that we can have something that's really neat and tidy about, for in health terms, what does that mean around courage in Birmingham, Bristol compared to, Manchester and Blackpool, or the pathways, knowing what that means around self-referral or family referral. So it's got to be a bit smart on the connections with local needs and requirements and what's building and growing in local authorities and ICBs and the NHS. But look, I'm a great advocate that you can't have too much. When someone is in need, they often don't know where to go until they're in need. And I think as soon as they're in need, Valor, Courage, a good Armed Forces Covenant, local authority system straight away should be accessible. And then it's then how they all work together.
Thank you for that. Sarah?
Thank you, Chair. I think I share some of the concerns about that the expansion is going to have a huge impact, and actually sometimes there's an element of getting back to basics and making sure that's working first. So I hear those concerns, particularly on funding as well. I guess the question is, and what was raised yesterday at our sessions, is that the statutory guidance is going to become very important to see how we're actually going to be rolling this out. So my question really is, so what do you think needs to be included, and what would you like to see in that statutory guidance to make sure that we can implement this properly?
Caroline?
I'm aware of time, but I think going back to that word about co-production, I think I would be talking too long if I was to say what needed to be included. But I think it's really important to co-produce it so that we make sure that people understand what it is and how it's going to work and it is consistently applied. I think that it would be my reflection from the last Armed Forces Act in 2021 that I don't know that we have achieved consistent application nationally yet, and that is obviously a worry when we're moving forward to apply more.
Okay. Peter?
Thank you very much. I was on the Statutory Guidance Committee, and it's over 40 pages long, and it tells us how to do things. But of course, it depended very much, as Caroline has said to the questioner, on proper consultation. So we need to know what is required, and by bringing all the partners in, then we can work out what is deliverable and how it can be delivered. Now, I don't want people to forget we have health, housing and education that went through, but housing, there's still people in local front offices turning people away, saying you don't have a local connection when the local connection's gone. And then I've got education ones where they're saying, well, I know you're a service child, but you don't have any rights, which is not correct. They should be considered. And in health, getting on the waiting list. Well, surely you're at the base at Pirbright, so you're with the medics there. You don't need to be on the local GP list. So it's a question of interpreting, and it's got to be softly. And we do need these focus groups. I say this immediately to Colonel Al. It's important that they get from all sides who then will make it possible to deliver.
Kate?
Look, statutory guidance, like any other statutory guidance, needs to be understood. So if I, kind of equate this to the Equality Act 2010 or whatever, you need to absolutely get this statutory guidance understood through the big strategic bodies, and then what that means for individuals and staff. Because the issue around statutory guidance is understanding why and what this, for me, patient family group means as part of serving reservists or veterans, and then how the statutory guidance is implemented as part of legislation. Because it's not a choice, it's a requirement, but it's something that's really lovely to do as well. And it's absolutely bringing it in with what the advantage is of this statutory guidance and where that impact will really, really make a difference to public sector services as well as the flow of our armed forces community. So look, there are people here on committees and delivery that will be much better at kind of looking at how that means as part of that statutory legislation. But ultimately, I think it is making quite sure that it's brought in a way which is seen as impact, advantage and leadership. And if we can get all of those right, then I think it will be something that's welcomed and seen as positive and not seen as onerous.
Mike?
Yes, definitely agree the points that have been reflected about jointly produced, co-designed, co-produced. It's particularly important from our perspective, so that the guidance can reflect the different nuances around the UK, respect of Scotland, different legislative context we work in, and the completely distinct arrangements we have in respect of our local governments arrangements, community planning partnerships, health and social care partnerships. So that's all reflected, as well as that, all the good practices taken on board in respect of development, and how this all interrelates with the new arrangement with the Scottish Government, devolved arrangements too. So yeah, I'd be very supportive of that, where we can be involved in influence and shaping it, because ultimately if we're involved in that, then we'll have ownership of it, and that'll help the delivery and implementation of it. Thank you.
Oh, you wanted to come in?
Yeah, just quickly on the, obviously as a committee we discussed this term of due regard quite a lot yesterday, and it's inconsistent, how it can inconsistently be interpreted. So just quickly, with the statutory guidance, it's really important this is right now, and it's just to, is it not, do you think the role of the armed forces champions within local authorities could be more standardised and formalised through the statutory guidance to assist with due regard?
Okay, Caroline, you put your hand up. So have you, Peter. So I'll take you, Caroline. Go on.
So me and Peter may say the same thing. So I think in certain places we have already sought to make that consistency. There's been a role descriptor for armed forces elected members and lead officers in our area that actually built upon some of the work that Peter had done in the Surrey and Kent area for a number of years now, since about 2018. But it's not consistently applied, and I think the statutory guidance could provide an opportunity. I'd also say about linking into things. We've just heard about the public sector equality duty. We locally have been considering the armed forces within our equalities impact assessment for a number of years, alongside with parity to those who are covered by the public sector equalities duty. That clear guidance within the statutory guidance would give a very universal steer across public bodies that I think would be a good win for this.
Peter.
Thank you very much for the question. Eden, today, immediately after this meeting at 10, I'm training on the legal duty to Armed Forces Champions, Councillor Armed Forces Champions, and I believe the legal duty needs to be understood, and by having this Armed Forces awareness training, it will help. I have provided in its MOD approved job descriptions for elected Councillor Armed Forces Champion and Covenant Lead officers. They're adopted right across the country. However, as Caroline said, there's no guarantee that it will be carried out in the same way by some of the local authorities. One of the issues with the bill, by the way, is it doesn't specify the Greater Manchester Authority. It doesn't specify unitary authorities. It doesn't specify, it mentions districts, but it doesn't mention boroughs. So people need to realise it's for all of those, and that's why the job descriptions will help. What I want to see is, I mean, I'm sad we're going to have to make it law, because there's tremendous goodwill out there for our armed forces personnel. And, you know, the best practice will drive it forward. So the job descriptions are there. I hope, as Caroline says, there'll be a consistency in delivery of the Armed Forces Covenant. And I know I'm very prepared to lead on that. And I've offered my services before, and I continue to. And I've done over 16,500 people being trained on the armed forces. And the job description features in every single one of those training sessions.
Okay,
Thank you.
Yeah, I think the due regard element is really important. And if you we've broken down what does due regard mean, and quote, it's around proper care and concern for the armed forces community, but it's then actually understanding what the armed forces community, what does that mean for women, what does that mean who are serving, or are spouses or family members, or what does that mean in different age elements, what's the concern around prosthetics, what's the proper care when we may be talking about different elements of mental health and PTSD, what does that mean around housing and homelessness? And what the point I'm trying to make here is actually going deeper into what does the due regard mean for proper care and concern for the armed forces community. And I'm sure, you know, I'm really, you know, Peter and I are both absolutely wedded in our training that we're doing, and we're doing a 5-layered module of training for all ICBs and trusts. But we've got a lot of lived experience involved in actually having case studies and stories that really get people to understand that as a professional, don't have a assumption of what you think an armed forces community is, and how due regard goes further because you understand the complexities and also the variation. And I think it's the word that Caroline used earlier. It's about making quite sure that it's consistent, and everybody that's in front of you as a patient potentially is going to be a member of the armed forces community.
Mike, do you have anything to add?
Yeah, it's just very briefly, Chairman. I think as what's been reflected, that there's a lot of really good work that's been undertaken in various local authorities around Scotland, and a lot of wholehearted support for the Armed Forces Covenant. It seems to be the case, so that because there's some differences, though, where you've got larger numbers of veterans or military service personnel families, that there's more services, more provision provided in those respective local authority areas. And what's also the case is that obviously with the Armed Forces duty to have regard, there's a great expectations. There'll be even more with this bill, is that the requirement for resources. And what we're aware of is that we don't have dedicated resources. Like, it's nobody's single job in any local authority across Scotland. It's just part of somebody's role. So it's just really underlining the need that having more specific resources for this for delivery, particularly with the wider range of services that's set out within the bill, will really be important dimension of it. Thank you.
I want to move on to the next question now, David.
Thank you, Chair. And Caroline, Kate, Mike and Canon, Peter, thank you for being with us today. And just to echo the sentiments from the rest of the committee, thank you for all you do for our armed forces. I think just to reference back to a Royal British Legion study that was conducted last August around the Covenant's awareness around the UK public, quoted 67 people in the UK had never heard of it and 15% only knew something small about it. I think that's very difficult when you try to implement it through government and then through delivery bodies. So what do you think the government and delivery bodies can do to work together to make sure that understanding is expanded?
Happy to start. So I think we really welcome within this bill that all departments across government will uphold the covenant, because certainly I have memories from the last bill enacting and having to let our local schools know that it had come into effect because there wasn't messaging from an appropriate government department to let them know. And I think what we'd be really keen to see this time is that consistent messaging across government going through those themes. So where are we seeing discussions around the covenant within the Ofsted framework? Where are we seeing them within CQC? Really embedding that it is a thing that we need to be doing and we need to be working towards. And again, that consistency of framework. I would also say that the reality of our local armed forces or national armed forces population is it's a transient community and it's going to need a sustained effort around this. So we're going to need messaging that meets the needs of that community at different stages that they're in, whether they're serving, transitioning, ex-service, service pupils. It's consistent and it's sustained, and we find that within any public health approach you have to keep that messaging up and you have to put the resources behind it to make sure you can get into communities, because just putting something out on a web page or on an Instagram post, or I'm not even completely down with the social media kids, but putting it out there, actually what makes a difference is trusted relationships, doesn't it? When someone's got a problem, they need to be able to talk to someone they know and trust, and someone needs to say, do you know what, I think maybe the covenant applies here, or did you know that op coverage is available to you? Yeah, and that's the kind of the grassroots almost led communications that we need to get to.
Thank you for that. Mike and Peter, I'm going to bring you in now. I know we've got a hard stop at 10 o'clock for you because you've got other meetings to go to. So can I say we're really grateful if you have to sign off while we're still taking answers and questions and answers, but thank you for your attendance this morning. So Mike, I'll take you and then I'll take Peter.
Yeah, I think we've got to look at it from a positive perspective about what the provisions of this bill provide, because extend it across government, devolved administration, the Scottish Government, as well as UK government departments. It provides that opportunity for that whole cross-government approach, and it's building upon that with those opportunities of collaborative policy development and service delivery will help to basically feed into having an increased awareness for stakeholders, armed forces community, that what's available, rather than we've implemented at a localised level. If we're doing it jointly with the Scottish Government and other UK government departments, it certainly adds a lot of impetus to the delivery of it, and it's about really making sure it's adopted effectively and getting those communication messages out and ensuring it's, as I said before, resourced. Thank you.
Thank you. Thank you, Chairman. A brilliant question. I was for 12 years Chief Welfare Officer for Surrey and Sussex Royal British Legion, and obviously I was reminding them all on the Covenant, and I think it's really important that it's promoted. I use the unit welfare officer meetings to promote the Covenant. As chairman of the South East Employers Recognition Gold Award Scheme, we know that we've got a substantial number of businesses who've signed the Covenant. Indeed, in the South East, I think nationally, we've got 14,000 companies that have signed the Covenant, so we use them. We use the libraries. I've got contact centres, which I've trained in Hampshire, up in Lancashire, even up in Inverness, telling them to ask the question, have you served? And that opens the door. We've got churches, I've got libraries doing it. We've got leaflets through our Forces Connect app, which please do download, which helps people get help without even leaving the barracks. So if you are a regular, you can apply there. And I find the Covenant is becoming more useful. I treat it as an insurance policy, rather like the AA, the fourth insurance emergency service. It's there if you need it. But all of you, please, as members of the Select Committee, promote the Armed Forces Covenant. It's there to help. It's there to enable our service personnel to have a good way of life and to be rewarded when things go wrong for the ultimate sacrifice that they themselves are prepared to take every day when they go about their daily job.
Right, David, I know you've got the second part to your question, but the Minister wants to come in, and I'm keen to bring him in before our guests, witnesses leave, and I'll bring you back in. So, Minister.
Thank you, David. Thank you, Chair. I think it's more of an issue. The Covenant is coming in, and the legal duty and due regard and statutory guidance is the overarching umbrella and framework for local councils to follow. Just a couple of comments have been made today. Guidance not to forget about the Covenant. The Covenant can't be left on the side. Every time I've met any one of the councils, usually when you have good leadership that understands the military, you have good implementation of the Covenant. I wonder if you could reflect on that and just give us a few from your perspective of where you see that working well.
Well, as I'm about to go, may I jump in? I do go around a lot of councils briefing them, and I brief not just the actual council chairman or the mayor, but I brief the leader. I brief all the party members. So I would go to Brighton Council and brief them, and they're working really well. They've just got the gold. I'm not surprised. They deserved it. It's a case of keeping the momentum up. And my biggest worry under the devolution is that some of those good people will be lost. And I urge people to think about that. I get the mayors when they go around asking, have you got any jobs? Because I've got service personnel looking for jobs who don't even understand the skills they've got. And they've got amazing transferable skills. So my belief is the councils can be the natural. I mean, I'm going Hart Council in a couple of days' time. I'm meeting people who are voluntary sector, who've got nothing to do, they think, with the military because they've never asked the question, have you served? And as Caroline said much earlier on, by the way, on the census, please keep the question in 2031, have you served? So I think the councils are very committed to do it still. And, you know, by someone like me going around, we keep them lively and committed.
Mike, before you go.
Yeah, it's a very good question. I think local authority leaders are very committed to Armed Forces Covenant, and what you find is, yeah, you will get good implementation and delivery when you've got the leader of the council involved, or indeed the provost in Scotland. What what tends to happen and can happen though is the role of armed forces champion or lead can go to another elected member, quite simply because the leader of a local authority has got so many responsibilities, and that can occur in many instances. But in saying that, though, it's about getting the overall political buy-in of every council, and I think across the piece we'll have that in most areas of Scotland. It's just really, though, having enough resource to do the actual implementation for the Armed Forces Covenant across services to meet the needs and requirements of members of the Armed Forces communities. Thank you.
Thank you. So, Mike and Peter, if you have to sign off, thank you very much for taking the time this morning. Kate, do you have anything to add in response?
Yeah. I've got my 3 colleagues in local authorities, and it's quite interesting sitting here because there's absolutely no doubt that 10 years ago I was getting exactly the same amount of questions about the inconsistencies and the lack of knowledge across the NHS. And I suppose I have the privileged position as director in NHS for Armed Forces to say that on reflection, by leading and having a funded, very high profile, knowledgeable, small, I have to say, team that focuses on nothing else than other than the quality and quantity of services for our armed forces community across the NHS has made a lot of difference. It's made the difference around getting evidence and culture and data. It's the collaboration actually with the third sector and the charities as well. It does not surprise me that the question comes from a survey from the RBL, because ultimately the Armed Forces Covenant or any good practice across cross-government and devolved administrations has to recognise that it isn't just if someone comes into a GP's practice. I've been heard to say this before, it's not about giving them a leaflet for a charity, an armed forces charity, however brilliant they are. We have responsibility to know what that means for the armed forces community, both serving reservist families and veterans. And I think that's the difference, and this being something that people don't know about. And as Caroline said earlier, something that's so embedded then people see that as, one, a joy, but also a requirement, and they won't shy away from it. Look, we've funded a number of bespoke services. We've got thousands of people that are now accessing. That's the best word of mouth for the Armed Forces Covenant, that people know that it's worked for them or their family. Or if they're in repeat issues, they can go back. It's not just a one-off. And I think that's the element that will be really important as we go forward. And I think that's the element that is absolutely important for moving the RBL service, moving the, from maybe hundreds of commissioning groups 10 years ago who didn't know what this means to every 25 integrated care boards going forward, knowing exactly what their legislation is, but also what's already there to use actively.
Thank you. Caroline, do you have this?
So I think you're absolutely right in terms of leadership, and I think coming hand in hand with leadership is that motivation and incentivisation. So where you've got large numbers of base personnel or veterans, obviously I think there's an intrinsic motivation there because that's your local population. You want to serve them. You want them to be happy with their services. Where you have more sparsely populated areas, that's certainly across our local government network where we do hear people perhaps struggling to try and get things done. I think going back to your role descriptor, our role descriptor says that our Armed Forces Champion has to be a member of the Cabinet, and we did that very specifically in 2018. I don't know if it's actually consistent with the other one, but we made that amendment because we felt the person needed the right authority and autonomy in order to get the job done, because often what you'll get is someone who's very motivated and enthusiastic personally, but they might not have the buy-in organisationally to be able to deliver. So we put that there. The other thing that we've done locally is some business case work around what difference does it make. So what difference does it make to the person, but also if we manage to get somebody into secure quality housing quickly and prevent homelessness, that is a saving. And early intervention struggles with this systemically in terms of demonstrating its worth. But ultimately, the Covenant is early intervention. It is about trying to prevent escalation and to ensure people get to services quickly. So I think one of the calls from local government was to have more opportunity to do that casework and that evidence-based work to help with that people buying into the changes they need to make, because they can then see the benefits not just for the local communities but really in those hard places like demand.
Okay, thank you. David, thank you for your patience.
Thank you, Chair. Very short question. Caroline, you touched on this in one of your previous answers. Is the view at the moment then that extending the Covenant's duty to Whitehall departments, will that make it easier then to collaborate properly with delivery bodies?
We absolutely hope so.
Yeah.
We think that's your aspiration, and we would share it. Obviously, I think all of the caveats that we've spoken about today in terms of implementation across local government equally apply to other government departments. There needs to be effective understanding, consistency, the resources going into those department areas to make sure that they are driving forward this change, because I imagine that they will have an awful lot already going on within their work stream, and what we want them to see is this being a fundamental piece towards meeting their aims as well as our overall country's resilience.
Just a very follow-up. Is there a view at the moment that there might be regional disparities across the UK when that's put in place?
At the moment, there already is regional disparity across the UK. What we would hope is that this bill comes in with the right, I suppose, supporting infrastructure to make sure that we don't end up in that place. But obviously, that is a risk.
Thank you.
Kate?
I mean, I think governance, it's a boring old subject, isn't it? But governance is really important in this because it absolutely has to be embedded in the requirements and also in the scrutiny and assurance. Because I think scrutiny and assurance and data and quality is absolutely important to see where you can build on good practice, where there may be one area that's got something really working well and where another area is struggling. You know, let's get a central point as well as part of local pathways that really kind of enable good practice to happen quickly. I think that's why Valor and other elements of, you know, the way that we've kind of scaled and commissioned Restore, Up Courage and Opnova. Opnova's a really good example of that question around cross-government departments. It's actually working with the MOJ and the prison service and police custody and courts to actually look at what that means for the armed forces, men and women that are part of the criminal justice system, what that means for families particularly, where they may be more hesitant about even speaking to their GP because they've got a member or themselves within the criminal justice system. So look, it's really great, and it's always, you know, immensely proud of being part of working for the armed forces community. But we have to accept that if the Armed Forces Covenant is going to work, it's going to work across government departments and devolved administrations where it hasn't been working, where it's been more tricky, and that may well be within the criminal justice system. It might be about violence against women and girls or domestic violence or sexual abuse, the work that Fighting for Pride has done around the LGBT community, etc. So I think it's really important that we push the bar on what the Armed Forces Covenant is about. And I had the pleasure of being with Secretary of State Wes Streeting and the Deputy Prime Minister as well, David Lammy, only last week. And actually William Vinell, who's following me in the next panel, was there too. And we were actually able to talk about the work we were doing in the NHS around the Armed Forces Covenant and the Armed Forces Patient Pathway as an example of how that could be used to support the understanding of patient pathway in the criminal justice system more generically. So how we actually get the Armed Forces Covenant to be part of the excellence of other elements of pathways and resilience at the same time.
Thank you.
Okay, thank you very much. Thank you for staying with us beyond 10 o'clock. We really appreciate you taking the time to be our witnesses this morning. So thank you for your attendance. And we'll move to the next panel now. Thank you.
Thank you very much.
Okay.
Thank you very much.
Sorry I couldn't be in, Pam. We were running short of time with the other two. Right, welcome. We'll start our second panel of witnesses this morning. Thank you for taking the time to come and give evidence to us. Would you introduce yourselves, please? Start with William.
Yes, so my name is William Vinell. I'm a director at the Department of Health and Social Care I have responsibility for a range of arm's length bodies, inquiries and policy on patient safety and clinical negligence. But I also have responsibility and the main liaison point with the Ministry of Defence for Veterans Affairs.
And I'll take it the first names are okay. Yep.
Yeah,
Nick.
sure. Thanks very much. Nick Hamer, I'm also a director in the Department for Work and Pensions. My day job is Chief Risk Officer, where I look after risk, national security, resilience and public inquiries, but I'm also the Senior Armed Forces Advocate and the link with the Ministry of Defence on veterans issues.
We'll go to questions. Pam.
Thank you very much. Thank you for joining us this morning. Can I ask you what practical differences the extended covenant legal duty will make to your departments? And I'm going to ask Nick first, because yesterday we had a panel where the DWP came up many times. It was raised many times by our witnesses. And how might the DWP change its practice as a result of the covenant?
So, I would like to start with where we're at the moment, and I would like to start with some of the positive aspects of this. So I think the first thing to do is to recognise the really fantastic skills for life that that service brings, and that is reflected in 88% of armed forces personnel going into work, as opposed to the national average of 75%. And DWP plays a massive role with employers in terms of getting them to sign up with the covenant. And we want to use this, and this will be a reoccurring theme through my evidence. We want to use this as a moment to sort of redouble our efforts and reflect on where we do have issues as an organisation. So that is one aspect of it. But where service leavers and veterans and their families do come to DWP and use our services, they are often very complex and very challenging issues. So where we play a role there is that we've got 50 dedicated armed forces champions across the UK out in our job centre network, and they work directly with veterans and their families to provide direct access and support into benefits. Where I think we would perhaps like to go further with this is one, thinking through what the duty puts on the department in terms of our further policy design. So thinking through where we are adapting things like our disability policy at the moment, so the TIMS review and how that's sort of played out in that. I think this is a really good opportunity, and many of your previous witnesses have talked about how this is used as an opportunity to communicate the covenant out within the department and refreshing different senior leaders across the organisation on their knowledge of the covenant. And then finally, I think making sure that we are, as an organisation, reporting back to Parliament on what we are doing through our annual report and accounts, so including that within that.
Thank you. Can I just push a bit more on that? You
Sure.
said that these cases are complex cases. Yep. What makes them specifically complex, and what is the DWP currently doing?
Yeah, sure. So I think it's complex in terms of the nature of people's service. So it often comes with a health component to it. So either medical discharge from service. It can come with a PTSD component to it as well. There can be other issues involved as well that mean that it takes both a social care and a benefits response to things. So the role of the DWP in that, in particularly the Armed Forces champions, and they are incredibly passionate individuals, and a lot of them are service veterans themselves or families of veterans. They play a role in coordinating a lot of the support there. So, for example, I visited Cambran, where our Armed Forces champions were sort of bringing together a local TA centre, various different charities, charitable organisations, putting on breakfast for sort of veterans of different age groups, bringing them together to sort of coordinate some of that direct support across various different agencies that could help them.
William, did you want to?
Yeah, so I think the practical impact of the duty is hopefully it will strengthen and deepen what we already do in terms of our liaison with the Ministry of Defence. And Kate, who you heard from in the previous session, is in a sense my opposite number, and we work in partnership in terms of developing NHS services. I think the second thing it will do, which is sort of more notably different, is obviously in extending this to departments and including social care. In a sense, for the first time, there will be, I think, a more considerable focus on how do we consider our social care policy in terms of how we take forward the covenant duty. I'll give an example of that in a minute. And I think thirdly, I mean, as a colleague was saying, the wider responsibility across the department and the way we report on that through our annual report or through the covenant duty will put us more on notice to be public and clear and committal about what we've actually done to improve services for the armed forces. So I think the kind of audit cycle that this brings in without making that into a procedure is very welcome. And if I can give you the example, I was coming yesterday, I was thinking, okay, let's think of an example of how this might start to change. So some of you know we're already building the Catterick Integrated Care Centre in Catterick to serve the needs, primary care and community needs of the armed forces at the army camp nearby. So the NHS and the regional system are right behind that. But a question we will now have to explicitly ask ourselves, and I think we've asked it implicitly before, is what about the social care needs? Does that centre need to recognise that? What's the liaison with social care there? And as a department, I mean, if you sort of strip away the legislation, if we're thinking about that and acting on it and trying to collect the data and trying to think positively about how we develop that in our policy, then we're taking on board the challenge of the new covenant duty. And if we're saying, oh, I hadn't really thought of that, or I'd forgotten about it, or we don't have any data, then we're not. So I think it heightens awareness, and in heightening awareness, it should make for future service developments.
Thank you very much. Can you describe how similar duties, like, for example, the public sector equality duty, is already factored into decision-making at the moment, and how that might be a model for what we're going to see going forward?
Me to go first on that one?
William?
So I suppose if you look at the public sector equality duty, I would break it down into three things: training, activity, and audit. And obviously for the PSED there is bespoke and general training. The intranet has guidance and tools on it that everybody can see. Of course, we need to remember that the public sector equality duty, which came in 2010 with the Equality Act, we had equality impact assessments for some years beforehand, so in a sense a path had been trod. So I think probably what we will need to do is make an introduction to the Armed Forces Covenant duty, and so that people understand the concept before they start to exercise it in the policy making. In terms of activity, I mean, these are a couple of forward-looking suggestions. I think over time, and this is a reasonably large task, so I just want to put it in broad terms, over time we'll need to look at our policies across the department in terms of how fit for purpose are they in relation to the Armed Forces duty. I think it's probably crucial, and the PSED, you know, going back up in the department quite a long time, a big challenge when that came in was to engage at the time of making the policy with representatives groups, focus groups and review groups. So you don't finish the policy and retrospectively say, and what about the public sector equality duty? You factor it in at the time, so it actually changes and develops your policy. And then I think thirdly, we need to look at data. What data have we got? Or if we haven't got data, how do we get it? Because it isn't a reasonable excuse to say there's no evidence, so I couldn't exercise the duty. The challenge is, well, what further questions do we have to ask? And then I think the last thing I would say is clearly there's the whole question of statutory guidance and the kind of statutory guidance we put forward. Can say more about that in a minute, but that's going to be another significant issue. So I think they're all learnings from the public sector equality duty, and then you have to get to a position where people know what the duty is, they've got it in their mind. It's a kind of tripwire at the start of policy making to think, and what about these particular interests? And if you do that, you then take forward the policy in a sensible way. And sometimes that duty has a large impact, and sometimes it has less of an impact. But the decision you've made has to be thought through, evidence-based, and therefore proportionate.
Sure. Nick, do you have anything?
Yeah, sure. I mean, I think just in preparation for this and more broadly in conversations with MED colleagues, just sort of thinking through some of those practical steps of how we can enhance the understanding of the covenant and the duty across the organisation. So, for example, I will be writing to programme SROs within the department to make sure that this is, factored into both their sort of policy and their programmatic thinking of services that are delivered across the department, and really using this as a vehicle for that direct communications into different bits of the organisation to make sure that we're living up to that due regard.
Thank you. And the final one for me is around arm's length bodies. Which ones in particular do you think that you currently collaborate with, will be most affected by the extended covenant?
So I sponsor 6 arm's length bodies for my sins. That's not all of them in the department. But I think I would have said NHS England, but clearly NHS England is going to come back into the department, so there'll be a slightly different set of arrangements, and you've heard from Kate. I certainly think the organisations that more directly deal with NHS services are going to be particularly impacted. So things like the CQC, how do they take account of veterans and serving personnel needs in the assessments and inspections they do, and they do some of that already, but how do they do it more? And then I suppose if you take some of the more bespoke organisations, say like NHS Blood and Transplant or the HFEA, NHS Blood and Transplant who do blood and organ supply to the NHS, you might say to them, well look, if I was trying to make it easier for armed forces or veterans to give blood, what would be a way of engaging for that? Would there be a certain place where we put on clinics, or a certain time that we have clinics, or things like that? So I think there's practicalities you can ask of all the NHS facing organisations, and then I think for the ones that are closest to the day-to-day of the NHS, CQC, and obviously in the future when NHS England comes back into the department, that part of DH will be particularly critical, which is effectively the area Kate works with at the moment. But I mean, going back to my previous question and what Nick was saying, we need to ask the questions of all of the arms length bodies, and they need to demonstrate that they've taken the duty on board.
Yeah, and likewise, and again, reflecting on this conversation, writing to chief execs of those organisations, but I think the primary ones for us would be the pensions regulator and ombudsman, where complaints are coming into them around sort of service-related pensions and other issues. And then sort of thinking more broadly, perhaps the health and safety executive as well, in terms of where they interact with the armed forces. But I mean, the health and safety executive and the Office of Nuclear Regulation are both employers that do employ veterans as well, so making sure that they're both combined. But I think the main ones in terms of service provision will be the pensions ombudsman and regulator. Thank
you. Jane, you want to come in?
Yes, you've covered most of the things I wanted to ask, actually, because my question was going to be about the actual practical differences. That, say, if you were a woman getting divorced from someone in the services and you applied for universal credit, what would be the differences with the extended duty than there would be before? You talk about the experts in the how many? How would they know? How would it change?
Yeah, so I mean, I don't want to say that it won't change a huge amount practically, because I don't think that the duty will change anything. I think I want to say that it won't change a lot because we're doing a lot already, right? And I think that's the main aspect of this. I think where the practical impact of the duty will bite is in terms of sort of broader departmental thinking, policy making, and programme work, and then also sort of as your actually quite helpful structure highlights in terms of that education, that understanding and communication. I think there will be an energy component to this which will be different in terms of the thinking that we'll have to deploy in it. But in terms of the sort of on the ground support that an individual will receive from things like the Armed Forces Champions, for example, that should not be different. We should be providing the very best support for veterans and their families at the moment through that mechanism. I think just on the champions specifically, I know you've touched on resourcing with other witnesses as well. Look, it is a helpful thing to fall back on when we are having discussions with the Treasury about how these individuals are resourced. That is definitely a component of this as well. To say that this is a legal duty is a helpful component to that.
Okay, Gerald.
Thanks, Chair. We touched a little bit on this, but I just wanted to drill a little bit further in terms of awareness. And could you sort of outline how your departments will ensure that policy teams are aware of the covenant duty and specifically sufficiently informed around the needs of the armed forces community in order to be able to meet their duty?
Fortuitously, we had a meeting with the MOD yesterday to talk about the production of the statutory guidance and all of that. That is going quite well. That will be produced. One of our jobs is obviously going to be to promulgate it in the department because we're the policy team that's responsible. I think there's a question about what other materials can be put forward, including things like videos and training. Our team is not huge, so the trick will be to come to us as a resource, but at the same time then to send it back out to other people in order that they take it seriously. I think one of the things that we can consider, and is I think a pretty obvious step, is on the front page of our submissions that go to ministers, there's a list of tick boxes, but tick boxes of a good kind, which is have you thought about the public sector equality duty? Have you thought about the devolution impact, etc., etc.? Well, it will be pretty straightforward to add this duty consistently with that. So in a sense, there's a tripwire to say, okay, have we thought about this? Yes, no. If yes, where's it demonstrated? If no, are we sure there isn't any relevance? And then obviously, I mean, as Nick was saying, in terms of the audit cycle and the sort of legal duties, there is clearly the ability in the reporting on the actions of the covenant duty annually from the Ministry of Defence to say what have government departments done and to ask people for information. And similarly for our annual report and accounts, there's the ability to have a small section in there about it. And I think particularly in the early years, we tend to report on the implementation of manifesto commitments, and clearly this was a manifesto commitment, so we should do that. And then I think the sort of longer term answer to your question is, we need to make sure that, this duty is inculcated in the minds of officials in just the same way as it is for the public sector equality duty. That is not an overnight process because you don't change minds overnight, but the combination of the audit and the training, and in a sense the challenges from sessions such as this means people start to move in the right direction. And obviously on social care, we've been having discussions with social care colleagues about, this in a sense, in a way, is a slightly newer thing for them than us. They do it already, but that's, I think, an area in our department of particular focus that we'll want to take forward.
Brilliant. And look, partly reiteration in terms of, thinking through how decisions are made within the department and how they're subsequently implemented, and how we can get into those. So obviously the submission process is a core component of that. So making sure that it is reflected within that submission making process and informed advice to ministers. In terms of our own department, there's a couple of bodies that I think would be quite important for us to hit. So the first is the executive of the Jobs and Career Service. So going to there, sort of presenting the duty and explaining that to the chief executive and her senior leadership team, and then because that is ultimately how information is promulgated through the Job Centre network. But equally, every job centre across the UK of a sort of Wednesday morning reflects on a particular issue, whether it be a new operational policy or something like that, and making sure that this is on that topic for conversation to create that awareness. And then again, using the Armed Forces Champions as an advocate for that, and also the Special Relationships team out into industry as well, to sort of signal that change where we have promoted it to certain employers and got them to sign up to it. making sure that they are then promoting that again and sort of redoubling that effort and demonstrating the change. And then I think there is a final reflection as a little bit difficult to comment on at the moment as the change is ongoing at the moment, but as skills comes into DWP as well, and apprenticeships, thinking through how that how that is sort of operating within the system. Sure.
Minister. Yeah, I'd just like to ask what, from a statutory guidance perspective, the implementation needs to contain in order to help your department. Is there anything we need to do to change it, make it more forceful, and enable you to deliver the outputs?
I mean, look, my feedback from the meeting yesterday that I got from colleagues this morning is that the development of the guidance is going pretty well in broad terms. I think there's a trick with any guidance that you need to make sure it's suitably lengthy that people understand what is trying to be achieved, but at the same time it is reasonably pithy so people will take it on board and do something with it. So in a sense, the trick with the guidance is to be a helpful set of tripwires for officials to think, did I think about this? Do I have the data? Have I taken it on board? Have I made the right points to our ministers in the development of the policy? You don't want the guidance to be a complicated maze where people think, crikey, this thing's 50 pages long, the desk is busy, how do I move on from that? The officials, can see through that because that's what we do for a living. So I think it needs to be pretty short and focused. I think departments need to understand what due regard means in legal terms, and and the four aspects that's in the legislation. When I was reading that, the third one, which said to make special provision for armed forces as necessary, I thought Catterick's a very good example of that. So I think there's a little bit about taking it back to the legislative bases and making sure everybody understands that, and then translating it into a sensible set of guidance that is sufficiently clear that people will read it and not so long that they won't.
Could you just give me just a quick summary of some of the good stuff that DWP are doing in support of the Armed Forces Command?
So that's more me. So I think in terms of what we're doing at the moment, I've highlighted the Armed Forces Champions, which is a sort of dedicated and protected resource to work with veterans. We also try to advantage them within the benefit system, but ultimately, we'd far prefer them not in the benefit system, and try through our sort of policies to recognise the kind of complexity for service for both veterans and their families. So for example with families, we give additional national insurance credits. There's changes in things like housing benefits rules. There's early entry to employment programmes. There's a whole raft of things, and I think probably what I'll do is sort of an additional is just write to the committee with just outlining what those specifics are.
Because I think, correct me if I'm wrong, one of the problems is often helping both service personnel, veterans, their families, and indeed those of the bereaved understand what is actually out there and is available.
Yes, I understand that. And again, this is why we have that kind of protected capability, because, and as I said, many of them are veterans or families themselves, so they have that understanding, they have that empathy in terms of what people coming through the door of a job centre, really feels. But, there is, for example, and this has come up in different conversations as well, the consistency of identifying whether someone is a veteran, and we've introduced a sort of a universal credit marker. So we do ask people, are you a veteran? And then that hopefully should, sort of trigger that kind of additional support that comes in. Will I commit to saying that happens all the time?
Families.
Say again, sorry.
Families.
So families, I don't believe are included. So it's serving personnel at the moment. So yeah, I think that's an additional. So that should hopefully trigger that additional support. Will I commit to say that happens 100% of the time? No, but more often than not it does. And also that sort of Armed Forces Champion network is well understood and known by the job centre services.
And did you want to come back on that? No.
No, sorry, I realise I interrupted and I do apologise.
All right. I'll bring you in, Luke. I've got Ian and I'll come to Luke.
Yeah, I'm going to say that was a good interruption, because my question was about the practicality of it all, is using IT systems. So if you go into a job centre, for example, they'll go in, and I was going to ask the question, is this embedded in your IT system, that it's a question that you ask, more like your minister's tick sheet when you said, ministers, have we took due regard to this covenant? Do you have that going in, and also does it include the families? But obviously with DWP we're saying it does for some of the benefits, but also the other ones if you're applying for jobs and stuff like that. Does it ask for the wider family, or is it just particularly?
No, just for veterans and service personnel, so not the families. Yeah.
Is that something you would commit to take away and include?
We'll take that away and look at it. Yeah.
Thanks.
Luke. Yeah, I know we're supposed to be asking the questions, but it was just to say I've seen this working in practice on the ground. One of my local job centres in Stanley, I was there only a fortnight ago. I met the guy that is providing tailored support to veterans. He's a veteran himself. He's doing both parts of that job, like people that were unable to work, he was helping them work their way through the benefits process and make sure they were getting all of the support that they needed. And then he was matching people that had really good transferable skills from coming out of the military. He was matching them to local employers. So this is very much working on on the front line of the job centres.
Sorry, I know you're not a witness, but can I just ask, what are you saying that person fulfilling that role in that job centre was able to sort of do more because of their experience and knowledge of the services?
I think it helped that they had a level of empathy and knowledge of the kind of problems that veterans would confront, but also of an ability to tease out of them what the skills they'd picked up were in the military and how that made them employable. It was definitely helpful that they had that background themselves.
Nick,
and as I said, our sort of special relationships team as well work very closely with the transitions partnerships, career transition partnership teams across the armed forces. So where we are getting large people coming onto the jobs market, or large numbers of armed forces personnel coming onto the jobs market, we can start to pre-plan, we can start to line up employers, and you think about the sort of the kind of the transferable skills. And I do this within the civil service, so I also look after reservists within DWP, and understanding, if you think about the logistic skills that RLC personnel have, for example, coming out into the labour market, that is directly transferable in a really easy lineup. And then one thing, sorry, I do just want to come back on that point about families. So we do ask if you're currently serving or a veteran, and as universal credit is a household benefit, it should pick up partners, but we'll check and write back to the committee on that.
Okay.
I'm just thinking about sort of partners, specifically ones who are separated, because that happens quite a lot in the military. It's kind of making sure you hoover up all of those people.
Thank you.
Okay, Rachel.
Thank you, Chair. I'm question 8, is that right?
Mm-hmm. You are, indeed.
Excuse me. Firstly, to you, William, how will you monitor implementation of the covenant legal duty within your department?
Well, I think we'll have to collect sufficient information to show that people have been taking the covenant duty seriously. We will, I expect, report back in the annual report. Yeah. We will need some kind of mechanisms, we haven't worked them out yet, akin to what we have probably for the PSED duty, so we can quantify the amount of impact that it's had and that people have taken it on board. And I think, as I said earlier, that we make it part of the submissions process. I think there is also, if that's a kind of quantitative analysis, there's a qualitative analysis of when you look back a year later. Okay, give me a couple of examples where the covenant legal duty has made an impact on the policy you've been developing in the way it hasn't done before. So I think we need to ask ourselves both the sort of the data questions and the information question, and obviously if we have the right guidance on the intranet, we'll be able to take that forward. And I think we will need to speak to PSED colleagues, because that was quite an undertaking when PSED was introduced 14 or 15 years ago, and now it is reasonably common practice. So all of those things we need to do.
Anything you would add, Nick?
Yeah, so I think a few things. So, firstly, I mean, as Mr. Khan said, the guidance is still in development at the moment, and there is something about inclusion within the annual reports and accounts process. I mean, for those of you engaged with it, it's already a bumper document, but I think it is important that it is reflected within that. And then for us, in terms of, I think it is about monitoring sort of trends within that universal credit marker, as I sort of previously mentioned. It's about stakeholder engagement and stakeholder feedback, and sort of take your sort of fantastic example there, appeals and benefit cases, and where we're seeing that coming from, the armed forces community, and then sort of, frontline staff and the feedback that we get. The armed forces, the champions, they are a vocal network in terms of feeding back into the organisation where they are seeing issues, and that passion does come through them. So I think those are sort of things that I would just put as an addition.
And I've got one obvious thing which I probably should have said is we have our partnership board meeting with the Ministry of Defence 3 times a year, which I'm the co-chair of, and clearly we'd want to make that we want to make this an agenda item in order that it stays on people's minds, particularly in the early years.
You've both spoken about annual reports and so on, which is a good way of keeping Parliament informed about how you're delivering the covenant duty. But how will you keep the public informed of that?
That's a good question. Well, by thinking about it, I suppose one of the ways you keep the public informed is by having a set of policies and achievements that show you've taken on board the needs of the armed forces, and that you don't have people coming back and saying to you, well, why didn't you think about us? Yeah. So if we and all our officials collectively get our job right, then it should show up in improved policies.
I suppose the other element of it is the sort of ongoing report. So Ministry of Defence report on it sort of annually. That's a public-facing document as well. I think we will reflect as this comes in terms of the communication avenues and approaches that we do, and that's not just within our staff. That's perhaps within our customers as well, and some external-facing comms out through sort of DWP, social media, and other things as well. So I think that's another way to get the message that there has been this step change out there, and that people understand their sort of rights and the department's obligations under the duty.
If you could sort of sum up, what do you think successful implementation would look like?
I think there's probably two angles for us, and if I just start with social care, because I haven't, there were one or two things I wanted to say about that. Yeah. So, I mean, as you will have heard from Kate and from some of the things I've said, in a sense, hopefully the needs of veterans and armed forces is fairly well established in the minds of the NHS, and you can see from some of the things we've done that changes have come from that. I think on the social care front, we're not at a starting point, but we're still in somewhat newer territory. And so one of the things that we will need to emphasise across the board is that the legal duty will include our responsibilities for adult social care policy. Local authorities will need to pay due regard to the Armed Forces Covenant when considering their social care duties. And as the lead department for adult social care, DHSC will consider the covenant in relation to any relevant policy development on social care. And then I think, on the NHS, we probably need to continue in the same vein, because we've got quite well-established work there. There's always more you can do. But we will need, as I think I outlined in my previous answers, to make sure that there is internal arrangements for monitoring that across the board of the department, the policy making is taking on board veterans' needs across the NHS, and it's not just in a sense through the lens of the people who worked on armed forces, but you take it more broadly.
Thank you.
Who have I got? David.
Thank you, Chair. William, just touch on a few of the points that you raised. So, from my understanding, you'll get the guidance from the MOD, you'll go off, you'll implement it and you'll monitor it, and then you would have 3 touch points throughout the year with the MOD. Yeah. How is that going to work in practice? Is that going to be a case of you just presenting to them, or you see it more as a collaborative process where they're showing what good's like? And then the follow-on then to Nick, are you going to have a similar process in DWP? And what's the view? Is this going to be a sort of cross-Whitehall and NHS thing? Is there going to be consistency so that the sort of output is similar? How does that look in practice?
Well, to answer your question, is it going to be a collaborative process? Yes. So clearly we have the touch points, we have the various monitorings and all the rest of it, but then you've got to scoop it up together and say, okay, do we think we're having due regard as the covenant duty requires? And I imagine it will be incumbent upon officials to be able to demonstrate to ministers when they periodically ask us if this thing is working through the system. So you need the touch points and you need the processes, but you actually need the activity as well. So I think we are going to need to, coordinate the totality of that.
Sure. What I would say is that there is an amount of governance within the civil service around veterans. We and health and others play a role in that in terms of attending those meetings. And when you talk about is this a joint endeavour? Yes, it absolutely is. We engage with the Ministry of Defence officials in terms of the development of both the guidance and the bill. So we've been involved in that, and we will continue to be so. And this is absolutely a kind of collaborative effort. I meet with sort of my counterpart within the Ministry of Defence as well and discuss these issues. They, highlight areas where they can see concern within the department. We think those through and we sort of respond to those on a relatively frequent basis. So there is a lot of engagement at both the official level and ministerial level on some of these issues as well.
And just a short follow-up. So obviously there'll be disparities across different departments about the data that you collect, whether that's quant or qual. So are you aware now of what the MOD are going to be asking for, and do you think there'll be a consistency in what they're asking for from your departments?
So, I mean, the guidance is being developed at the moment, so I don't know. It's the short answer. Is the short answer to that? I think there's a push and pull factor here. So I think that the Ministry of Defence will want a lot, and there'll be what the departments can provide in terms of what we can develop, and there'll be a gap in terms of how we sort of manage that in terms of consistency and coverage.
Yeah, I mean, I would have thought that the request stroke challenge from the MOD will be a set of expectations that they would like to see reached across government. And people, as Nick said, will be in different starting places, will have different amounts of data, and will be differently ready for that challenge. And the MOD will probably be saying to us, could you please fill that gap as quickly as possible? And the serious point for the departments will be to think, well, how do we do that? What do we need to change? What do we need to do more of? And at the end of that process, if there is an end to the process, what different departments do will still look different. It won't be an absolute consistency because they're doing different things. Yes. But if you compare all of that back with the duty and say, have you had due regard in doing all of this to the best of your abilities, then we're moving to a sort of position of progress. So, there will be different gaps to fill at the start, and as Nick said, we'll have to see how things play out and then take that work forward. Thank you.
Is there a point of where the buck stops in each department? I mean, this is clear that Parliament, in particular, wants to see a step up in terms of the way we treat our ex-service people, which clearly feels has been inadequate over a very long period of time. So, within your departments, if it's deemed that you're not fulfilling what was expected, who carries the responsibility for that?
Well, I suppose in the end that message will go back to the officials responsible for those areas, and they would then take it back to their ministers. And we collectively as a department, ministers and officials, we would be responsible for that. And there's a set of ministers who are known to be responsible for these areas in government departments, and it would come back to them and us.
Yeah, and then also, I mean, there's a reason why we've talked about the annual report and accounts as well. In terms of that is the primary mechanism by which the department accounts for what for the permanent secretaries account for what the department has done on behalf of Parliament over that period. So I think that is a sort of primary vehicle there, and it'd be interesting to see how many times Armed Forces Covenants issues actually have been raised at that level in the past. And I think that might be a change for the future.
Ian, I'll come to you now.
When you were talking there and asked how you were going to check yourself, I was thinking of Denham's cycle, plan, do, check, and then act. And I'm thinking, yesterday's evidence, we heard from the head of the services, families or associations, the Royal Air Force, Army, Royal Marines and Navy. And I want to ask, do you meet with those heads of service or not? Because as part of the checking process, they would be the ones, because it was them that we heard evidence from yesterday who had failings within the DWP and the health and social care aspects, what they'd been coming across with themes, not just individual cases, but themes, where it has gone wrong and it's currently going wrong now. So I would suggest that as part of that cycle of meeting, reporting back with the MOD, and the MOD is part of that checking process as well, because obviously they deal with the MOD and they've got themes there too. I'm just thinking maybe you should all speak together. That would be a real good, from my perspective, is that if you made it a regular thing that you met with them to pick up these themes, because they're the ones that are reporting back to select committees, and as part of that check phase, so then you can go away and act. And I think that's, I know it's a revolving circle, but I was just thinking that I think you're from a question that Pam asked yesterday about the DWP, and it came up, so I was just thinking that.
Yeah, so we have and we do, and a number of organisations have written to ministers in the past. A number of MPs have written to ministers in the past around sort of specific cases or broader themes, and the department has answered to respond to those. And there's a number of sort of on the record statements from ministers about those issues.
We have representatives of the Armed Forces families on our partnership board, and that was introduced a couple of years ago to try and sort of bring us up to speed with, hearing direct from the voices of people who need services or can't find the services. So I think, we can always do more on that. So happy to take that away as a suggestion.
Yes.
The Covenant's a cross-cutting strategy, and it's extended in that way. Really, the VORG strategy, which came in just before Christmas, is trying to do the same thing. Are there any lessons that you're already learning from trying to implement the VORG strategy across departments that can be carried across to this area?
Well, okay, this is a sort of partial answer. So when the first women's health strategy was put into production back in 2020, my team was responsible for that work originally, and then it passed on to other people. And I suppose my reflection on that, and then looking at the VORG strategy now, is you have to do quite a lot of painstaking work to get to a position where you have a cross-government strategy in the first place, and to pull all the data together. That's quite powerful. And then after that, you need as we've been discussing, a reasonably sophisticated way of monitoring the impact of those. Now, I think, being perfectly honest, I don't know whether the ambition for the Armed Forces Covenant is equivalent to that, but there are always clear learnings, looking at Minister Cairns, there are always clear learnings about how people in other parts of government are trying to, amplify key messages and what we can learn from that. So I think, we should certainly look at things like that, because if you'd said 10 years ago or 15 years ago, violence against women and girls, you wouldn't have got much of a hearing. Right? Whereas now everybody understands that's a significant government policy and needs to be taken forward, and we've got the infrastructure. So I suppose there's an open question about how this policy develops in its ambition.
Yeah, it's a good question, and one I'll definitely take away and reflect on where this has worked in the past. I think the thing that I'll say is we've spoken a lot about the kind of the guidance and the process on this. There is something about how departments resource the increased focus on this area and a number of other areas within sort of parliamentary interest. So I think there is as your sort of cycle predicts, a kind of thinking about this, implementing it, and reporting on it, and how we get that cycle right, and learning from other areas of policy that have done this well or not in the past. I think is quite important. Thanks.
Any more questions from the committee? Okay, well, thank you very much for your time this morning. Thanks for coming and giving the evidence. We're really grateful. Thank you.